Hello, thanks for joining me. Today we're going to be talking about Pes Anserine Bursitis, coming right below the Pes Anserinus, an important and often overlooked cause of medial knee pain, especially in athletes and in individuals who perform abnormal or incorrect movement patterns during training or daily activities. From my experience, this is also a topic that educators often highlight as clinically relevant. That means they can actually appear in your licensing exams possibly because of its long, impressive name, which they seem to enjoy bringing up. By the end of this session, you should be able to recognize the condition, understand the mechanisms behind it, and outline effective management strategies. So, let's get started. All right, so where can we locate this small bursa that is responsible for this particular disorder, Pes Anserine Bursitis? We're going to begin by grounding ourselves in the anatomy. This bursa is a small protective fluid-filled sac. Think of it like a gel-like structure and is positioned on the inner side of the knee. So this is the femur, this is the tibia, and we have the fibula right there. This part is going to be the lateral part, and this is the medial part. Our interest is going to lie in the medial part, okay? Medial knee pain. So this bursa sits right between the upper part of the tibia and the combined tendons of three important muscles, which I have depicted right here. That is the sartorius tendon, the gracilis, and the semitendinosus. These three tendons together are what we refer to as the pes anserinus. Okay, actually, the name Pes Anserine came from the way they sort of fan out like the webbed foot of a goose. So it actually means, um, you know, the foot of a goose, something like that. And just as a quick side note for anyone who's inquisitive about these structures, the sartorius is actually the longest muscle in the human body. Okay, so I have depicted the tendons right here. You can see the green, yellow, and red. That is where the tendons lie. And in between the tendons and the tibia, you see that blue depiction right there. That is the Pes Anserine bursa. Okay, this little bursa plays a big role. It reduces friction, cushions movement, and helps these muscles glide smoothly with every step or when you squat or when you climb. So when this part becomes irritated, even simple movements can become surprisingly very uncomfortable. So this is the same depiction right here. We have the medial part of the knee on this side, and you can see the depiction of the Pes Anserine bursa right there. So what are the risk factors that predisposes one to this disorder? And here several factors come together. It often starts with repetitive stress, okay, on the Pes Anserine region, which you already know where it is located. Things like extensive movements, overuse, and incorrect training techniques. This is why runners and other endurance athletes commonly feel it. Okay? Think about trauma as well. Whether it is a direct impact or indirect strain, can also trigger inflammation around the area. Structural issues play a role too. So, deformities such as a knock knee alignment, or a flat feet can alter the mechanics around the knee and increase stress on the bursa. And we also see this condition in patients with degenerative osteoarthritis. In fact, tight hamstrings, okay, muscles are another contributor since increased tension along the medial knee can place extra strain on the pes answering area. So overall, multifactorial issues could be involved, especially with the disorder being prevalent among obese middle-aged women. All right, so clinically, Pes Anserine bursitis usually presents as pain on the medial side of the knee. It's very important. If it is on the lateral side, probably you're dealing with something else. So here we are looking at the medial side of the knee, about 5 to 7 centimeters below the joint line. So you can see the joint line right here. Okay, this is the knee. And so we are talking about the medial side of the knee, about 5 to 7 centimeters from the joint line. The pain can range from a dull ache to a sharp or to a stabbing sensation. Patients often notice it worsens with quick changes in direction or side to side movements, which put extra stress on the pes answering region. They may also experience tenderness and sometimes mild swelling in this area. So this illustration shows exactly where the discomfort is typically felt. All right, so when examining a patient with a suspected Pes Anserine Bursitis, we follow the usual joint assessment. We look, feel, and move the joint, check the range of motion, and then palpate the medial knee. Tenderness is often found over the proximal anteromedial tibia right there, about 5 to 7 centimeters below the joint line. That is exactly where the Pes Anserine inserts. Even though the bursa lies deep to the tendons, you may sometimes feel effusions or thickening, and crepitus may be present, which can indicate inflammation of the bursa. Again, the illustration here also reminds us that any tenderness at the joint line should raise suspicion for some different disorders. So, if the patient's pain is at the joint line, you could actually be dealing with a medial meniscal tear or a stress fracture on the medial side. Okay, we also assess hamstring flexibility using the hamstring popliteal angle right there. And here we have the hip flexed to 90 degrees. The leg is simply extended. A flexion angle which is greater than 15 to 20 degrees suggests a hamstring tightness. While Pes Anserine bursitis is usually diagnosed clinically, imaging becomes important if symptoms persist despite treatment or if we suspect another condition like a stress fracture or a meniscal tear. Options include an X-ray, ultrasound, or MRI, each helping to visualize the bursa or rule out other issues. In some cases, a technetium bone scan may be used especially to check for a tibial stress fracture, which can sometimes mimic or accompany Pes Anserine pain. The choice of imaging depends on symptoms, severity, and the clinical scenario. Ultrasound can also help exclude cystic lesions, while MRI is highly sensitive and very useful if further evaluation is necessary. The treatment of Pes Anserine bursitis is usually conservative. Rest or reducing excessive activity helps the bursitis settle, while ice packs and non-steroidal anti-inflammatory drugs control pain and inflammation. Physical therapy is also key. This includes stretching, knee taping, and targeted exercises, as well as treating concomitant disorders. And for cases that don't respond to conservative measures, additional options are available. These include extracorporeal shockwave therapy, ultrasound and electrical stimulation, local injections with anesthetics or corticosteroids, and sometimes surgery in rare persistent cases. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.